Hi, good morning Aston. My name is Mihira. I'm your invigilator for the OET-speaking session on the 28th of September 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Aston Wilson.
Okay. What is your candidate number?
My candidate number is 717375577.
All right. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
What is your job?
I am a nurse. I work in a hospital, and I am responsible for caring for patients. My duties include providing medications, monitoring patients' vital signs, and assisting with medical procedures. I also provide emotional support to patients and their families.
What are your professional goals?
My professional goal is to become a nurse practitioner. I want to be able to provide more comprehensive care to my patients, and to have more autonomy in my practice. I also want to be able to teach and mentor other nurses.
What are your strengths and weaknesses?
My strengths are that I am compassionate, organized, and efficient. I am also a good communicator, and I am able to work well under pressure. My weakness is that I can be a bit of a perfectionist, and I sometimes put too much pressure on myself.
What do you like most about your job?
I like most about my job that I am able to help people and make a difference in their lives. I also enjoy the challenge of my job and the fact that I am constantly learning new things.
What do you find most challenging about your job?
I find most challenging about my job that I have to deal with difficult patients and families from time to time. It can also be difficult to cope with the emotional demands of the job, such as when patients die or when they are in a lot of pain.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good morning, I am Aston Wilson, one of the nurses in the clinic. May I know why you requested to see me?
Good morning. I've been referred by the doctor after being diagnosed with a left foot ulcer.
Oh, I see. I'm here to assist you. I understand this can be a worrying situation. May I know your name, please?
My name is Mihira.
Mihira, can you please tell me more about your ulcer?
Sure, nurse. It began about a month ago, but I'm not sure what caused it. I have pain, but there is no discharge.
I see. I'm really sorry to hear that you're going through this. It must be concerning. Mihira, can you share your concerns or any questions you may have about the ulcer?
Yes, I'm worried about it not healing properly and possibly getting infected.
Mihira, I understand that you're concerned about your foot ulcer. It's normal to feel worried or frustrated when you're dealing with a wound that takes time to heal. Foot ulcers are not uncommon, and most people make a full recovery with proper treatment. However, it's important to be patient and consistent with your care. Foot ulcers can take time to heal, especially if they are deep or large. Mihira, one of the most important things you can do to help your foot ulcer heal is to avoid scratching the area. Scratching can damage the wound and increase the risk of infection. If you feel the urge to scratch, try to distract yourself with something else, such as going for a walk or listening to music. Please know that you are not alone, and there are people who care about you and want to help you heal.
Thank you for reassuring me. Can you explain how to recognize if the ulcer is infected?
Absolutely. I'm here to provide you with all the information you need. Mihira, let's now talk about how you can recognize if the ulcer is infected. This is crucial for your ongoing care. So, signs of infection that you should be vigilant about include, firstly, increasing pain. If you notice that the pain in or around the ulcer becomes more intense or persistent, it could be a sign of infection. Secondly, redness. Keep an eye on the area around the ulcer. Mihira, if you see any increased redness, especially spreading outward, this could indicate an infection. Thirdly, discharge from the site. If you observe any unusual discharge, particularly if it changes in color or consistency, this is another red flag.
Surely, nurse, I'll make sure to watch for these signs.
That's perfect. Mihira, early intervention is crucial because, if an infection goes untreated, it can lead to more severe complications. It might spread to surrounding tissues, or even the bloodstream, which can be very serious. Prompt medical attention can help prevent these complications and ensure the best possible outcome for your recovery. If you ever notice any of these signs, or have any concerns, please don't hesitate to reach out. We're here to provide the care and support you need.
I appreciate you explaining this. It makes me understand the urgency. What are some ways to manage this ulcer?
You're doing great by seeking information and taking an active role in your health. There are various methods to manage foot ulcers. One option is to keep the ulcer clean and moist. This will help to promote healing and prevent infection. The second option is to improve blood circulation to the ulcer. You may also want to wear compression stockings to help improve circulation. This will help to deliver oxygen and nutrients to the wound and promote healing. The third main point is to maintain good nutrition and hydration. Eating a healthy diet and drinking plenty of fluids will help your body to heal the ulcer.
I see. What are the next steps? Do I need wound dressing?
You're being proactive about your care, which is excellent. Yes, wound dressing will likely be part of your treatment plan. The next step is to clean and dress your wound. This will help to prevent infection and promote healing. Depending on the severity of the wound, I may also need to perform other procedures, such as stitches or staples. Before I do anything, I need to obtain your consent. Do you understand the procedures I have explained?
Yes.
Do you have any questions?
No.
Okay, then I have your consent to proceed.
Yes.
Thank you for your consent.
That is the end of your OET speaking roleplay. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.